So I really love to use the Pilates method of exercise for strengthening and working on flexibility of the pelvic floor muscles. So one of the exercises that I use quite often is called knee stretches. And in this position, we're bending deeply in our pelvis and our hips. And in that position, our pelvic floor should be relatively relaxed. And then as we push our legs back, we move into a Kegel or pelvic floor contraction. The easiest version of this one is where you have your knees on the carriage and you're extending your legs behind you as you do a pelvic floor contraction. As your legs come back, your pelvic floor muscles should go back to a relatively relaxed position. Then the second progression would be where your knees are lifted off the carriage and you're more in a plank position. The third and final progression would be where you're on one leg. At the same time, you're kicking one leg behind you and bring the leg closer to you. The bridge progression is a really nice exercise to use on the reformer for pelvic floor strengthening and flexibility as well. So when you're lying flat on the carriage, your pelvic floor muscles should be relaxed as your hips are deeply bent. As you roll up into the bridge position, we should start by using your pelvic floor like you're doing a Kegel to initiate the movement, and you keep some tension there as you keep your bottom lifted in the air. This exercise is done most easily just lifting your bottom up and down from the carriage where it's not moving. The second progression would be where you lift your bottom up and then you move the carriage back and forth while trying to maintain that pelvic floor stability. The third progression would be where you're lifting your pelvis up and you have one leg in the air and one leg doing the bridge. An important thing to remember is that Pilates exercises can really activate the pelvic floor muscles. So we want to make sure that we're not just activating, we're also focusing on the release between the exercises. So as your bottom comes down and your hips bend deeply, that's a great time to focus on releasing of the pelvic floor, which is just as important as the contraction.